Hospice myths and misconceptions, separating fact from fiction. At Peaceful Hope Hospice and Palliative Care, we recognize that hospice care is more than simply a choice for individuals with a terminal illness. It is an eventuality for many. But for every patient who receives hospice care, there are an equal number who don't grasp it. Qualified professionals at Peaceful Hope Hospice and Palliative Care teach the truth about hospice and contribute to eradicating the stigma associated with this crucial service. Is it a myth that hospice is only provided at an inpatient hospice facility or hospital? Fact: anywhere a patient resides is able to provide hospice care. Wherever the patient feels most at ease or where services may be delivered most successfully is where Peaceful Hope Hospice and Palliative Care renders services. Despite the fact that hospice care can be provided in a hospital, nursing home, assisted living facility, or hospice center, many patients prefer to receive it in the comfort of their own homes. We understand that hospice is a type of treatment that focuses on managing pain and symptoms at any location. Myth: hospice care is only for people giving up on life. At Peaceful Hope Hospice and Palliative Care, we uphold the fact that hospice is ultimately not about dying. Hospice aims to support people living the best lives they can in the time they have left to them. According to research, patients with life-limiting illnesses who select hospice tend to survive longer and report having a higher quality of life than those who opt for intensive end-of-life care. Is it a myth that choosing hospice care means giving up control? The fact is that the patient always has the power to decide when to stop receiving hospice care. When to choose hospice and who will offer care are decisions that are ultimately made by patients and their families. The finest treatment is provided when we first listen to you, your family, and your doctor, and when we work together. Some hold the myth that hospice care is expensive. Peaceful Hope Hospice and Palliative Care professionals elaborates the fact that hospice is a Medicare and/or Medicaid benefit that is fully paid, has no time restriction, and is covered by numerous private insurance providers. With no out-of-pocket costs to the patient, the majority of plans cover visits, drugs, supplies, and equipment relevant to the hospice diagnoses. Nursing and other medical staff visits, social assistance, specific therapies, and spiritual counseling are all included in care. Veterans who use hospice care are also covered by the U.S. Department of Veterans Affairs. Is it a myth that once you decide on hospice, you can't go back? The fact is that patients are free to discontinue their hospice care at any time. They might opt to seek out curative treatment once more, or their medical condition might become better. In the future, patients can reapply for care. Myth: hospice care is only for people with a few days or weeks to live. The staff at Peaceful Hope Hospice and Palliative Care understand that the biggest benefit of hospice occurs when pain and symptoms are managed, and patients have time to form enduring emotional and spiritual bonds. Patients under care achieve their best quality of life for the rest of their life. Hope changes from curing the disease to living a life as fully as possible. It is a myth that only a doctor can refer someone for hospice care. The fact is that anyone can refer someone to hospice, which is one of the most important truths about hospice that everyone should be aware of. A patient may be referred by relatives, the clergy, nurses, or others. A doctor's order is required to qualify a patient for coverage when a family member, friend, or other close relative believes the patient will benefit from hospice care. Myth: hospice care ends with the passing of the patient. Fact: hospice includes a significant portion of bereavement or grief support. After a family member passes away, Peaceful Hope Hospice and Palliative Care provides families with a full year of grief assistance. We can assist with planning funerals and other post-death difficulties. Myth: hospice is only for people with cancer. Fact: patients of any age with a prognosis of 6 months or fewer to live can get hospice care. End-of-stage cancer, dementia, heart disease, lung illness, stroke, or coma are just a few potential reasons for admittance. Myth: hospice and palliative care are the same. Fact: both offer assistance to people and their families on a practical, emotional, social, and spiritual level. Only after a patient decides to stop receiving treatment for a terminal illness can hospice start. Patients in hospice are still being treated for any diseases that are unrelated to their hospice diagnosis. People at any stage of illness can receive additional medical and social assistance through palliative care. Peaceful Hope Hospice and Palliative Care helps patients live out their final days with the least amount of pain, suffering, and worry, even when there may be little to no hope of a cure. In fact, a 2010 study found that hospice patients had a higher quality of life and lasted nearly 3 months longer than those who just received basic care. Finding out the details about hospice care is the only way to decide if it is the right choice. We are dedicated to giving you and your loved ones the best care at Peaceful Hope Hospice and Palliative Care. Our knowledgeable staff is here to address your concerns and remove any myths about hospice care that you may still be thinking about.